Your lymphatic bestie here with a couple tips on lymphatic drainage for the abdomen, for bloating, indigestion, stomach pain, menstrual cramps. I want to talk about the pathways. So our cisterna chyli sits right above the belly button in the center of the gut. The direction we want to drain all lymphatic fluid in the belly is to the cisterna chyli. The inguinal ligaments and the inguinal lymph nodes sit right here on each hip in the fold of the hip at the groin. These areas drain the lower legs and the upper legs. So all of the fluid from the feet up to the groin, you are pulling into these lymphatic areas. You have 1 to 20 lymph nodes on each hip. Everything above the hip, above the pelvis, and below the belly button will then move upward to the cisterna chyli, the biggest lymph node in your body. So make sure not only is your touch lymphatically correct, which means we are using gentle traction of the skin to guide that lymphatic fluid, which is at the surface, to these major nodes so it can circulate back to your heart and be distributed to your organs, and then you can poop, pee, and sweat those toxins out. But if we're doing improper techniques and moving the lymphatic fluid improperly down improper pathways, it can cause stagnation, bloating, and sometimes even pain. So make sure when we are working on the gut, we are guiding all abdominal lymphatic fluid to the cisterna chyli. So above the groin and below the belly button, we're pulling up. We're stretching up. We're pulling that skin up. Lymphatic drainage in the gut, this technique is manual lymphatic drainage. It is a therapeutic treatment. You do not need oils or lotions. That is lymphatic massage. It's not as focused on detox. It's more of an aesthetic modality. So when we're trying to use this for the treatment of bloating, pain, cramping, or just water stagnation and digestion, please use no lotions, no oils, and make sure we're guiding everything to the center of the gut above the belly button. So again, if we're draining the legs, we bring that fluid to the inguinal lymph nodes in the groin, and we start at the thigh. Small skin stretches down towards the knee. Then we hit the popliteal lymph nodes behind the knee, gently guiding that skin upwards again towards the groin. Once we open this lymph node, we can start working our way down the calf, the ankle, into the foot, and then pulling all this fluid to the groin. When we're working on the gut, skin stretches up, skin stretches down and towards the middle, and those are the proper lymphatic pathways. There's a lot of information out there, but this is coming from a lymphatic specialist. I specialize in this. I'm very passionate about it. If you have any questions, leave a comment below.